think we're here today to try and inform as many veterans as we can. We're here with Dr. Bash.
Welcome, Radio Land, TV Land, and YouTube viewers and listeners. This is Dr. Craig Bash. I've been doing veterans medical opinions for 30 years, and I have dozens and dozens of these radio shows which we're going to publish on this YouTube channel, and number 1 through whatever. So thank you for listening, and here we go.
Bill's going to say something about secondary injuries, Bill, or are we going to talk about some CUE stuff for both?
Yeah, I was thinking about those things today. Let me throw a monkey wrench into it, though, for a minute. Not long ago, today, I just reviewed a story in Smart News indicating that they reviewed a study of veterans in VA nursing homes that found in 25 states veterans were either suffering with injury or placed at immediate jeopardy. That distressed me so much that I wanted to bring it up, if I may.
Well, poor quality in nursing homes, Bill. Is that was the idea?
Yes, those were inspection reports, from April through December of 2018. Private contractor, and they found deficiencies in 52 out of 99 VA nursing homes.
Oh, my land.
That caused actual harm to veterans. And in 3 facilities, they found veterans' health and safety in immediate jeopardy, and in 8, they found veteran harm and jeopardy.
Yeah.
So that's the majority.
Bill, back in the day when I used to work PGA and I was doing those site visits, going around, part of what I did was going to nursing homes at the same time, And then I uncovered a lot of the similar kind of stuff you're talking about. I think I found out that the ones that were attached to hospitals were better than the ones that were displaced from a hospital because they had more staff and more supervision and doctors were in there more and stuff like that. But I found some horrific problems too. I found a lot of veterans in civilian nursing homes too that were also not perfect. So, I'm glad they're doing this survey, and supervision is really important to look for standards. The problem is that those nursing homes back in the day weren't accredited, like the Joint Commission never used to go around and check on nursing homes, so those places could get kind of sideways.
Well, I know Sherman Howard was working on that. He's in Georgia. And he said the one there in Georgia, down around, I think Atlanta, Georgia, where he lives, was such a pitiful mess, and he'd been complaining to everyone, and they just won't pay attention to him. I don't know what it's going to take to get these nursing homes squared away. It's just not right that they treat the elderly veterans in such a way.
Right. Bill, that's right. It's exactly right. And surveys are good. Inspections. Bill, who did the inspection? Was it a private company?
Yes, it was a contractor. Who
paid for it? Did the VA pay for it?
Let me see. I might be able to find that. Let's see.
Because that would be... in my experience, those inspections are really powerful. We could start a philanthropic organization to do inspections, Veterans helping veterans.
That's true. Yeah. I'm reading that now to see what I can find. While I'm scanning through here, I'd like to mention that I, too, were amongst the service officers assigned to monitor health care at a variety of VA hospitals. And as I recall, one of the most frequent breakdowns was the failure to turn patients who are not able to move themselves, and the result being the cubit ulcers, or what's called bed sores in common terminology. And the breakdown that I found most often was that when the patient is admitted, they're supposed to have these skin care protocols written by VA attached to their chart bedside, and each interval when the patient is scheduled to be turned, the nurse or the attendant is to initial the box and write down the time that they actually turned the patient. What I observed was, at that time, that those protocols were not always making it to the bedside. Now I hope there's some improvement because they've gone to electronics now, that, you just look in the screen, and the screen should tell you turn the patient every so many hours. And so that's one aspect. And I did note in this article that bed sores are one of the ailments that they found occurring too often. Inspectors found that staff at more than 24 VA nursing homes failed to take steps to ensure bed sores healed or new ones didn't develop. They can occur when frail people are left in the same position too long. In Cincinnati, one resident had 5 bed sores in 6 months, yet when inspectors visited, they found no one moved the man or put cushions under him for hours.
So
this is
are they marking? Are they marking them that they did turn them and then they didn't actually turn them?
The article didn't say. This is in the USA Today and the Boston Globe collaborating, I guess, USA Today, and this article that came to me on Smart News came in just 4 hours ago. I want to say, for a time, when I was stationed at one VA hospital and tasked with trying to help, I was serving on committee at the hospital. One of the things that became obvious was that for patients with severe debilitation, like a paralysis, they are vulnerable to respiratory infection and urinary infection. And lo and behold, this article is citing those same 2 problems. But when I was at this one particular hospital, the chief of neurology there decided and mandated that these paralyzed patients, when they come in, instead of going to an infectious disease ward, which was what routinely goes on for a patient with an infection, they would be admitted to the neurology ward, where they had better equipment, staff and greater spaces, and better immediate experience dealing with people who are vulnerable for these types of disabilities or problems. And the rates improved at that hospital thereafter. Don't know what's going on there now. But my goodness, I want them.
Oh yeah, the manpower is huge because you can form a pressure sore in 20 minutes, But what I found was that when the nurse staffing numbers were too low, the pressure sore numbers went up also. So
yes, and that's what was happening in the infectious disease ward, and they have a higher caretaker to patient ratio in the neurology ward, so it worked out to be much better for the patients. I just needed to get that out there. And of course, if anyone wants to know if someone's been harmed and they believe it's due to negligence, fault, or lack of judgment, compensation by VA may be available for any additional disability caused by VA care. You'll find that in Title 38, United States Code, Section 1151.
Probably anybody with a pressure sore, those are totally preventable and totally known about. So you could probably argue, I could argue that the pressure sore is negligence. So.
And I have to say, in my observation dealing with VA employees, physicians, and physicians who were serving in an adjudication capacity to advise on adjudication claims, my recollection is that they were somewhat of the uniform opinion that development of a pressure sore is a known risk, and that's going to happen in a certain number of cases, regardless of the quality of care. And I just never personally bought into that. Never did.
No, that's not. That's dumbing down medicine. It's been known for years you can prevent it, but people, it's a manpower issue, so they're trying to, minimize.
Yes,
it.
and those decubitus ulcers take so long to manage and to heal. It's an arduous course.
Then once you get a scar, you're at higher risk for it to repeat, yada, yada, yada,
Yes. Would it benefit if we run down the requirements for such a claim?
What's that, Bill?
Yeah, should we sort of mention what's required to prevail in such a claim?
For 1151? Check up.
Yeah. There's been a long history, of course. There's been a provision. The original title was 351, and then it got renumbered back in 1980. For many, many years, VA said there had to be fault, there had to be negligence or some other basis to compensate a veteran. And then a case came about in Brown. The courts found that VA's imposition of the fault requirement was in excess of that provided by the statute and set that aside. The VA had to compensate a great number of veterans for disabilities incurred as a result of VA treatment. The following year, after Congress paid the funds necessary to pay those claims, Congress enacted a new statute at 1151 and reimposed the fault requirement. So that was a very expensive proposition. There is this finding that these are spelled out in 38 CFR 3.358 and 3.361. Guidance is also provided by... Yes?
Oh, yeah. So we said this... Well, go ahead and finish your sentence. I'm sorry. Go ahead.
Okay. Guidance was also established by VA General Counsel, Presser's Opinion 40-97. Now, there are criteria that must be met. And the first prong is that you actually have an additional disability. It actually must exist, okay? And to determine that, you are required, as VA is required, to assess the physical condition immediately prior to the beginning of care, and then after whatever relevant incident is claimed to be responsible for the additional disability. Now, once you satisfy the threshold requirement of actually having an additional disability, the next requirement is to show causation. Now, this is different from service connection in this regard. You may recall from one of our earlier discussions that service connection for a disability, relating it to military service, may be shown either by causation or by coincidence. For example, if you develop hypertension while you're on active duty, it's service-connected. You don't have to show that something happened to you in the military to prove that it was caused by the military, because it was present during your military service. So, unlike that, 1151s do not permit a finding of coincidence. There must be actual causation. The words require both actual and proximate causation. So you can't come in 10 years later and say, I think this might have been caused by a treatment I got 10 years ago. Now, don't misinterpret that or don't allow me to overstate it. There's no statute of limitation. So if you have a disability that you think is related to VA care, you certainly may file a claim regardless of when that event occurred. Now, once we establish that there is an additional disability, then we've established actual proximate causation. Now we have to establish, is it a result of carelessness? Is it a result of negligence? Is it a result of lack of proper skill? A result of error in judgment? Or some other instance of fault that proximately caused the additional disability?
So, Bill, those don't have to have all those. It could be any one of those, right?
That's correct. Any one of those that I've discussed so far are independent bases for finding that you've satisfied what we generically refer to as the fault requirement. Now, let's say VA didn't do anything wrong and they did exercise and provide good care. Nonetheless, if the care or treatment furnished was done without informed consent, that might provide a basis for compensation. So if you go in and the doctor says, okay, I'm going to have this surgery and it has a risk of infection and it has a risk of bleeding, okay? And you consent. And after the surgery, you are paralyzed with paraplegia. They didn't mention paraplegia in the informed consent. Therefore, that might provide the predicate to allow compensation. Now, the last criteria is an event not reasonably foreseeable based on what a reasonable health care provider would have foreseen. Okay? Not completely unforeseeable or unimaginable. One that a reasonable medical provider would not have considered to be an ordinary risk of the treatment provided. Okay? So those are some of the parameters. Yes, Doc?
You remember that case, that angiogram case, or do you have an example we can talk about for that unforeseen outcome?
Actually, I was thinking of a surgery that we did review. I'm not sure if you and I happened to work on that same case at the same time, but I do recall a veteran had repeated surgeries to the cervical spine and had wound up as a quadriplegic as a result of the surgeries. And in that case, there was ample medical evidence to demonstrate, yes, it was a result of the procedure. It was a result of VA care. There was an additional disability. But there was no fault, negligence, or substandard care involved. They did a good job, but the outcome was unfavorable. We prevailed in that case because once all of the records had been reviewed, it was determined that the veteran had suffered what's known as a tethered cord, where the calcification process from the degenerative joint disease had, in effect, tethered the cord to the vertebrae. So it was somewhat immobilized. During the procedure, it was necessary to expand the space between the vertebrae in order to insert bridging material to fuse the two vertebrae. When they expanded the space, of course, they're stretching all the tissue around, but what they had not foreseen was the fact that this cord had been tethered, and when they did that, it stretched the cord. And that compromised the circulation, the cord began to degenerate, and the result was quadriplegia. So that's an example of an unforeseen complication. So that's kind of a brief rundown. Yes.
Unexpected, kind of the unexpected outcome, right? Bill, the idea that it's not what you expect to have happen.
Right. What a reasonable healthcare provider would have anticipated. Okay. Now, generally speaking, you're going to find those predictable complications or consequences on the informed consent that the patient signs prior to the procedure. If it's not included in the written authorization, in some cases the court has permitted VA to present evidence showing that the physician had discussed it with the patient, and that was documented in treatment records. So that's another way VA can say, yes, we warned you about this. Mm-hmm. Yeah.
Usually the way I interpret that is that, I understand informed consent and that they might say that there's a 5% risk of XYZ, But that means, in my mind, that the expected outcome is that there won't be any XYZ, So even if XYZ happens and it's on the informed consent, I still write it up as a,
I understand, but that's not exactly that's not exactly spelled out in the guidance available to us.
Yeah. Well, I push it that way with my medical opinions, because I think it's not the same.
And the way to figure these things out is to get them adjudicated.
Right.
You first file your claim at a regional office with appropriate documentation. Then you get a decision from the regional office. If that doesn't go favorably, you appeal to the Board of Veterans' Appeals. Ultimately, perhaps to the court, if there's an interesting question of law, they would be interested in reviewing that and interpreting what the rules are.
Thank you all for listening. That ends this show. And now I'm going to zoom off.